I'm Dr. Elena Rios, President and CEO of the National Hispanic Medical Association. We're here today at Neighborhood Health to talk to three physicians about the importance of their experiences with COVID-19 and especially with the Latino patients that they had to take care of. The three physicians are Dr. Carolina Perez, Dr. Eduardo Mariel, and Dr. Fernando Ortiz. We're here today to talk about the importance of COVID-19 and the impact that it has had on the Latino community, where we know that we have seen twice as many hospitalizations and deaths than the non-Hispanic population. And we've also seen the importance of many messages that have been barriers to our communities getting vaccinated. But despite that, many Hispanics have gotten vaccinated. And we want to learn from the experiences of our doctors at this clinic so that we can share this with other doctors around the country who take care of Hispanic patients.
My name is Eduardo Mariel. I'm an internal medicine physician. I trained in Texas. I practice both in Texas, Puerto Rico, and now in Virginia. And currently doing primary care at the Neighborhood Health Clinic here in Alexandria, Virginia. My main interest is to help the company that I work for close the gap in health inequality. And with that being said, 60% of our patients are currently from underserved communities such as the Hispanic community. So I'm very excited to have this opportunity and to share some of my insights as to how we have dealt with these difficult months of the pandemic.
Thank you. Well, thank you for being here. Next, we have Dr. Carolina Perez, who also is with Neighborhood Health at the Casey Health Center.
So I am a pediatrician. I grew up in Colombia, trained here in Virginia at Innova, and have been practicing at Neighborhood Health for the last 2 years. And oh my God, what an incredible 2 years with this pandemic. And so I'm really happy to be here to talk to our parents and our doctors out in the community about how we can better support families in this COVID pandemic.
Thank you. And last, we have Dr. Fernando Ortiz, who's also with Neighborhood Health at the Merrifield Center.
Yes, thank you for having me here. My name is Fernando Ortiz. I'm from Puerto Rico. I've been a physician for 35 years. I train in New York. So I've been with Neighborhood Health for the past 3 years.
Oh, that's great. Just by way of my background, I'm internal medicine by training and public health, and I consider myself a public health doctor, being involved in policy here in Washington, D.C. But I know how hard the journey has been to go through the medical system in this country. And so we're very honored to have these three Latino doctors here today. So thank you very much. Okay, so the first question I'm going to ask is, what are some of the key factors that have influenced the health outcomes of your patients, especially the Latino patients?
Hispanics traditionally are very hard workers, and we are represented in the essential workforce. So while the rest of the country was in indoor home protection, our patients were out working, keeping the economy rolling. And so, of course, that increased the risk of getting exposed to the virus. Along those lines, our Latino patients usually come from households where there's multi-generational households. You have abuela, mama, and children. And so what happens is one gets exposed, the rest of the house gets exposed. There's other social determinants that also had an impact on our Hispanic population. And those are some of the things that we at Neighborhood Health are trying to close the gap on.
What are some of the other factors that you guys have seen?
A lot of our families kind of have certain other social or health conditions that affect them. So for example, we know obesity is a big issue in why adults or children are being hospitalized. And of course, at the beginning, when we didn't have the vaccine, that made everything much harder. And then also, from the pediatric side, we didn't have those vaccines for pediatrics way months into the pandemic. Yeah. And so I think initially a lot of families felt unprotected, they felt exposed. And so it really helped when, we actually got the authorization to use vaccines in 5 years and above, because that really expanded the possibility of protecting our children.
My experience with some of the patients we have, they work very hard. So to come to see the doctor when they only do maybe $25, $50 in a day, it's very difficult for them to find to get the health care.
So, what has the COVID-19 pandemic taught the doctors and nurses here in the clinics that you need to let others know? What are some of the lessons learned?
The main lesson is we have to build trusting relationships with our patients and our families, because they're gonna come to you in the end to ask for your advice and your professional opinion. And we all know there's a lot of misinformation and disinformation that has been, put out there with the intent of harming, the vaccines campaigns and some of the health of our population. And so it is very important for us to be able to talk to our patients about, I care about you as an individual. I know your medical problems, and I'm here to advise you on the best solutions for these.
What else do you think for the other doctors here were barriers in the system to help other doctors? You're in community health centers, but to help those doctors in the hospitals that have to take care of your patients, what other barriers have you noticed? Especially with the adults who are really sick.
Because of the social determinants, a lot of our community lives in poverty level. Many of them are working jobs that don't provide the sick leave option, and so if they take a day off, they might lose their job. It's been noted that our Hispanic community has been hit hard with unemployment during the last few months of the pandemic. So there's the fear factor.
So do you think some of those structural barriers have led to the higher hospitalizations and the higher death rates among Latinos because they waited so long?
Yes, I believe so.
Yeah. And as doctors who are bilingual, what are tips for those that are not bilingual who are taking care of our Latino patients across the country?
After practicing over 25 years, I have found that has been one of my greatest tools, building rapport with patients, is that you get to greet them in their own native tongue. It builds rapport, it builds good communication, it makes them trust you, and it allows you to chip away at some of this misinformation and disinformation that they're exposed to. Nothing beats speaking to them in Spanish.
If we're going to be working with Latin personnel and patients complaining about having difficulty, shortness of breath, chest pain, chest pressure, things like that, is an absolute necessity to have the staff who can speak the Spanish.
Yes, it is so important. I know that we initially had them in English, and once we started giving handouts in Spanish, people finally were able to access the website, access the tools, know that there's medications that you can access in the first few days that are going to prevent bad outcomes. So things like that don't necessarily get out that much by word of mouth, but if they can see all the handouts and resources and websites in their own language, that's going to close that gap too.
So what are strategies that you have learned or have used to combat misinformation that our Latino communities get in TV, Spanish TV, radio, especially in social media too?
Address the fears, right? There's a lot of fears out there. And what I've experienced in my office is that 70% of fears is about the side effects, And it's okay. You can have fear. I had it too. And so we have to be the voice of what we know and how we've trained and the studies, what they show. That's what we do. So bringing that information to our patients, it's crucial.
Well, I first have to ask what are they afraid of? That's very important. And most of the times are little things. The pain, my friend has some swollen nodes, and I tell them that's something to be expected from the vaccine. Then I give them my personal experience. I have probably 9 or 10 patients who got sick. They went to the hospital, and they didn't do well. That could be you, or that could be your family, or you can give it to your family and your children.
Yeah.
And that is a terrible price to pay for having a fear of an injection. Also, I tell them that the injection has been tested for millions of people.
And again, as doctors, how do you approach a discussion with your patients in a more culturally sensitive way?
Well, I try to speak in very simple terms, in Spanish directly with them. I don't push them, but I do present in simple terms what the FDA does to approve medicines and vaccines. And so I go in a very simple manner explain what a double-blind randomized control trial is. And when you present how it's done, then they say, oh, so this is how you make sure that it's not a placebo effect and it's actually the control and this and that. And so I spend minutes explaining that in a non-scientific way, and patients turn around and say, you know what, it makes sense the way the science is being conducted. So a lot of times you just have to take it to the simple level. And again, you have to have that report, and you have to have that trust.
Dr. Perez, with parents that didn't have the vaccines for children, how did you convince them to take the vaccine themselves?
Yes, so the first thing that I talked to them about was, well, first, they need you. Your family needs you. So, a lot of parents are like, yeah, I'll vaccinate my children, but me, no, I can't. And so I start by that, our community has some of the worst outcomes out there. And so we need you to be a mother to your children, or to be a father or a grandparent. And you're the caretaker, so you really need to protect yourself. So that really made an impact, because I feel like all family members, they're like, oh yes, I am who has to show up for my family. The second thing is for kids, we all know that with vaccination, it decreases the amount of infection, but you could still get it. Now, what I've seen in my experience is that virtually none of vaccinated children are being admitted.
If a pandemic would happen again, we know there's a lot of variants with COVID-19, but if we would get into the same pandemic situation, what would you do differently? What have you learned that you would tell your patients, tell your staff, tell your medical staff on what to do first?
Clear communication. They have to understand that when a medicine or a vaccine comes out, it's been thoroughly studied, and it has been through the rigorous scientific approval method. I think that once they understand the pyramid of evidence that is involved, because they trust you to take other medicines you prescribe, so they will trust you when you recommend vaccines.
Well, thank you very much for this segment on vaccinations and COVID-19. And from the National Hispanic Medical Association, we know how important it is to organize our doctors and to educate other doctors about the important lessons that as Latino doctors, you have taught your patients and taught us today. The COVID-19 is not going away, but we have to be careful and continue to be mindful of the importance of our families, and that we need to protect all of our family members. And I think I'll just say thank you very much for being here today.
Thank you for
Thank you.
having us.
Thank you. The National Hispanic Medical Association is proud to have been supported by the CDC to start a Vaccinate For All campaign a year ago. We have had monthly COVID briefings. We have trained doctors for media placements. We have developed monthly meetings with the White House and our Hispanic Health Professionals Leadership Network, and we have developed a National Hispanic Medical Association Leadership Fellowship, all training doctors and others to be advocates we call champions for the Vaccinate For All campaign. Champions are individuals or organizations who join the National Hispanic Medical Association's Vaccinate For All campaign to be advocates and talk to their patients or their communities about the importance of getting vaccinated against COVID-19. We invite you to join us at vaccinateforall.org so that you too can be an advocate for your community.